All right, we are live.
Great. Hi, everyone. My name's Jason Harari. I'm an attorney with the ACLU of Virginia, and we have the privilege of hosting Dr. Annalise Roque Gardner. Dr. Roque has shared has been kind enough to share her time with us, and I just wanted to introduce myself and my co-hosts, Sean and Marcy, and then give a little bit of background, and then we can get right into Dr. Roque's biography and answering some of the questions that come up. So, like I said, my name is Jason Harari. I'm an attorney at the ACLU of Virginia, and my pronouns are he and him.
Hi, my name is Sean Winetta. I am the legislative liaison for the Humanization Project. I work with Jen Carter, the co-founder of the Humanization Project, and my pronouns are he and him.
Hey everyone, so grateful to be here. My name is Marcy Hampton. I'm the paralegal at the ACLU Virginia. My pronouns are she, her, hers, and I'm glad to be here with such great folks.
Okay, so as we get started, we just always like to begin our town halls every month with the COVID-19 Justice Coalition, a little bit of what we're about, and we'd like to sort of articulate the demands that we have from the Commonwealth of Virginia, from the governor, and from the legislature. So the COVID-19 Justice Coalition is several organizations that have banded together since the beginning of COVID, nearly a year ago now, to seek more positive outcomes for people that are incarcerated. Our demands are that the governor release as many people from incarceration as possible, as safely and quickly as possible, and release the number of conditional pardon petitions that Governor Northam's office has reviewed and granted. We have, of course, issued an invitation to Governor Northam, inviting him to participate in these town halls every month. It is an open invitation. So far, we have not received a response. However, we do have a space for him, and it will remain open until he chooses to go ahead and join us to hopefully address some of our questions and some of our concerns.
Great, thanks, Sean. It is an honor for me to introduce Luis Oyola of the LAJC. He has a decade of organizing experience, including building a multiracial coalition against ICA's private immigration detention center in Farmville, pressuring city officials to increase efforts to investigate the disappearance of Sage Smith, demonstrating in solidarity with Black Lives Matter, and much more. And at LAJC, he led the De-ICE Virginia campaign, helping to bring an end to local government contracts with ICE and exposing the Norfolk Sheriff's secret contract with ICE, passing legislation paving the way to inspect Farmville, and while also supporting mutual relief efforts at the start of the COVID-19 pandemic last year. And so with great work by Luis, and he is here to talk to us a little bit.
Thank you so much, Marcy, for that introduction. So I'm actually here to read a statement from Dr. Taj Mahal Taft. Dr. Taj Mahal Taft is a sociologist and criminologist who is currently behind bars at State Farm Enterprise Unit in Powhatan. Among other ongoing endeavors, he has helped found the Point program there and is the co-founder of the Humanization Project alongside Jin and Sean, which works to humanize people behind bars to help drive criminal justice reform. So what follows are his words. First, I just want to thank the coalition for allowing me to address you all. I hope this sheds some light on what we are experiencing behind bars as the vaccine has rolled out. Feeling a bit like lab rats, we are stuck in an unfamiliar maze full of misinformation and traps. Movement hindered and senses dulled as we face the pandemic and the almost equally intimidating vaccine rollout. Did you hear Hank Aaron died only a week after his vaccine? I heard they use DNA technology that will change my genes. A guy in California got both shots and died of COVID a few days later. Now they are finding all these so-called new strains just to scare us because not enough people are getting the vaccines and the drug companies need to sell more. Nanobots. We've all heard these doubts and conspiracy theories, scaring millions from the vaccine, limiting overall efficacy and reducing public safety. Well, imagine navigating that without the internet or access to doctors for answers. The situation behind bars is a more condensed version of the same, including the detrimental consequences. A complete lack of transparency and communication from leaders, limited external information streams, and confining conditions has created the perfect storm. As a result, we have been forced to make potentially fatal decisions in the dark with our hands tied behind our backs, much of it due to active and passive disregard from the Department of Corrections. To start, we were asked 3 times for final vaccine decisions, starting around the new year, without any actual information being provided to us, not even which brand of vaccine. We got fed brief snippets of clickbait headlines via small talk from officers, friends, and even loved ones. Not intentional, but an unbalanced viewpoint. We see TV news reports focused on viewer maximizing doubts and worst cases, only a dozen channels and no fact checkers. An ingrained and historically legitimate distrust from unethical medical treatment is the baseline understanding within prisons and among the overrepresented African American communities. We have lived years in a system we have seen devalue our humanity, with leadership happy to leave us in the dark, lie to us, beat us, stick us in solitary for years, and literally ignore sewage pipes leaking in our kitchen. During the pandemic, it has gotten worse too. DOC has made use of this situation to eliminate all positive opportunities for residents without implementing enough safety procedures to actually keep out the virus. Refusal to test each staff member before each set of consecutive workdays, halt the non-essential enterprise shops, or don full PPE for close contact, even as staff are the only way in. Asked directly, high-ranking officers have claimed they just don't feel like it. Yet, they readily ended all education, rehab, religious, and visitation opportunities without offering any guidelines for reinstatement. Safety as a cudgel, not a tool. So, trust is at a minimum and the cacophony of misinformation reigns. On top of that, we were privy to partial information in a rumor mill. Folks in the medical unit were given vaccines early, and a few instances of aches and pains came back, growing into eyeballs coming out and near-death reactions. When a few workers from the area were offered early shots, the nurses there proudly spoke of not getting it themselves and spread unrealistic fears. Officers were not made to get them and then came around us during decision time boasting about not doing so and further spreading falsehoods loudly. Still no real info for us to decide with, a couple vague generic posters, but only flyer level depth without real evidence. Thus, we asked questions, both conversationally and via request forms to medical as we were told specifically to do. Our first queries were ignored entirely. A second attempt was made with a simple, none of this information is available, to literally every question, even when data clearly exists. My closest friend asked the best nurse, and she told them she wished they would let them come educate us and answer questions, but they were actively disallowed from doing so. We had this coalition bring our questions straight to the Department of Corrections top brass, and they were told we had answers when it was not true. Then they suddenly put up a list of incentives, mostly junk food, promised for those getting the shot. Still no info, but now a bribe, fueling doubts about motives. This all adds up to understandable skepticism and doubt for anyone. It's amplified among an undereducated populace historically mistreated by all institutions and people involved. What would you do in such a situation? This deliberate refusal to provide the information necessary for informed consent and safe medical decisions lacks logical motivation but has a huge impact. The day they brought us shots, one final chance to opt in was offered. As they went through, a loud contingency refused, yelling out the doors for others to follow based on misinformation and real historical abuse. At least 30% refused, even where risk is highest and out of our control. and there remains a regular chorus of loud anti-vaccine sentiment. Then the next day, they finally brought a new flyer after the vaccines were given. Vague one-sentence promises against a few conspiracy theories and a general safety claim. No data and no reference cited, but it was still the best we got after the shots. Then a few days later, my first written questions came back, a month after being sent. Now the answer was flyer sent. Still no efficacy or demographic data, nothing useful. Imagine now the impact of those refusals. Think of our circumstances, trapped 78 people in 3,000 square feet of shared space for a year straight. Cloth masks given months ago. Officers and admin unwilling to take real precautions, submit to testing, or don full PPE, even as the only possible vector in. No way to distance from each other or officers. Now, project this 30% refusal, probably lower here because I have access to real info and small influence, up on the 2.4 million people behind bars. Even just the 35,000 in Virginia Department of Corrections. How many more unnecessary deaths will we accept? The resistance to answers amplifies our danger in a setting where life is already devalued so much. And that was a statement from Dr. Taj Maham Heft, resident at State Farm Enterprise Unit in Powhatan and co-founder of the Humanization Project. Thank you all for your time.
Thank you to Luis for reading that statement, and especially thank you to Dr. Mahantaf for providing that powerful statement. I could not have framed the issue better myself. There's this deficit of information, and Dr. Roque has been kind enough to share her time with us and hopefully answer some of the questions that people on the inside are having, but have just not been able to obtain answers for. So Dr. Roque is a current second-year infectious diseases fellow at the University of California, San Francisco. She completed her undergraduate studies at Harvard College, medical school at the University of Florida College of Medicine, and her internal medicine residency at the University of California, San Francisco. She is a proud Cuban immigrant who is passionate about caring for underserved communities with a special interest in caring for Latinx patients living with HIV.
Great. Thank you, Jason. I'm very pleased to be here and to be able to provide some information to the families of those folks that are incarcerated, and that can hopefully be disseminated to those on the inside. Personally, my family has been affected by incarceration, and so this is a situation that is near and dear to my heart, and I know of the challenges and the frankly, the atrocities that happen. And so I'm very happy to be here, and I am open to answer whatever questions come up. I just wanted to sort of start and set a broad overarching information to say that the information on COVID-19 or on coronavirus from the scientific community, I think changes on a daily basis. We're getting so many studies now, we're getting so much information from vaccine companies that I will provide as much up-to-date information today as I can, but with the caveat that things are changing quite rapidly as we get more information about different strains, about the different vaccines that are available. But just to know that if something that I say today maybe changes in a month, that is the course of science, and that is understandable. We know far more about this virus right now than we did a year ago, and we're gonna know far more in a month and 6 months and another year.
Thank you, Dr. Roque. I appreciate that. I guess I can start off with what one of the most frequent questions that I've heard and that my colleagues have heard from folks who are incarcerated is, unfortunately, many people who are behind bars have already contracted COVID-19 due to kind of how the poor job that prisons have done handling it. And some of them are reluctant to get the vaccine if they've already had COVID, because don't they have some sort of natural immunity? And it just seems like when you're weighing against, there are side effects to the vaccine. why go through those side effects if you've already had COVID and already have natural immunity to it?
And that's a great question to start this off, because it speaks to the idea that this is a novel virus that we're learning about every day. And so what I would say is that at this point, as of today, we know that natural immunity from COVID-19 is present and likely lasts for anywhere for 3 to 6 months. That being said, we don't know how long that immunity is going to last overall. And so if you had COVID-19, yes, you likely developed antibodies after your infection, but 3 months after your infection, 6 months after your infection, we don't know if all of those antibodies are present or if any of them are present. And so we recommend, and the CDC is recommending, that even if you have COVID-19, that you should get the vaccine, because we simply don't know how long natural immunity is going to last.
Great, thanks, Dr. Rook. And I have to put this out here really quick. I went to the University of Florida as well, so it's really special to speak to a fellow Gator. So it's really, I'm really excited to have you here. One of the many questions I have is, if someone is healthier and doesn't have the underlying medical conditions, as we kind of wait for supply to catch up with demand of the vaccine, should younger, healthier folks maybe hold off on getting the vaccine so that those who are in more vulnerable populations can get it?
So unfortunately, and I differ to all of you that know more than I do about this, I'm not sure that incarcerated folks are going to get more than one opportunity in this situation. And so my kind of general advice to those that are incarcerated and those that are out in the community is that when your time is up, we strongly recommend that you take your shot at that point. I think it's very noble to want to leave vaccines for those that perhaps are more vulnerable, but I'm not sure how prisons are going to prioritize those situations. And so I think the right thing to do for yourself and for your health is to take the vaccine when your shot is up and when you're given the opportunity.
So Dr. Rook, I spent about 16 and a half years in Virginia DOC, and there's a progressively aging population within at least the Virginia Department of Corrections, and I think nationwide. And a lot of those people have chronic conditions, particularly as they begin to age or because of lifestyle prior to coming to prison. So a lot of them are on one medication, maybe several medications. And I know from my conversations with some men that I was incarcerated with, they're concerned that their medications might have bad interactions, perhaps, with these different vaccines. So are there any medications or anything that if somebody's taking that they shouldn't get the vaccine, or any sort of research about sort of bad interactions with the vaccine and medications that people might be on in prison?
Generally, there are no contraindications to taking the vaccine with different medications. The one true contraindication right now that the CDC is recommending people talk to their healthcare providers or really think about not taking the vaccine is if you've had a serious reaction to a vaccine in the past. And I'm talking anaphylaxis, or your throat closing up, you needed to be hospitalized. And this is specifically to another vaccine. Not talking about food allergies, we're not talking about allergies to other medications. If that is the case and you have had a serious reaction to a vaccine in the past, then I think the best course of action for folks that are incarcerated are to not take the vaccine, because there's such difficulties with them talking to healthcare providers when they're incarcerated. That being said, medications, there are no contraindications in terms of other medical conditions that patients may have. That actually makes the recommendation stronger for you to take the vaccine. We know that people that have diabetes, people that have high blood pressure, high cholesterol, a lot of the things that come with an aging population, that puts you at risk for more severe COVID. So that is a reason, an even stronger reason, to take the vaccine, not defer it in that situation.
quick follow-up on that as well. There's a lot, particularly in prison in Virginia, there's a lot of people that suffer from hepatitis and HIV. What about those? Obviously, more sort of outlier that you don't find as much in, the general population in the public, but you do with people that are incarcerated.
Great question, and this is my area of expertise is in HIV and actually in hepatitis C, and so we know that participants living with HIV were included in some of the initial trials. That being said, those patients had stable HIV, we would say. They were not, as we would classify them, as AIDS defined, or their immune system being more suppressed. So with patients that are living with HIV, we definitely strongly recommend that they take the vaccine. I can tell you from my own experience, I have various HIV clinics here in the city. My patients are starting to get vaccinated because one of my clinics is at our VA here, and it's quite an aging population, and they're doing great. And I have had no issues with any of my patients living with HIV getting vaccinated.
Thank you, Dr. Roque. I guess no, that's a great follow-up question, and it kind of links into one that we just got in from the chat. Is it safe for a woman who's pregnant to take the vaccine? And I guess related to that, the individual who asked that question in the chat, is it safe for someone who is pregnant who just tested positive for COVID to get the vaccine, or should they wait?
So let's answer the first question, because that's actually a very hot topic. So women people that are pregnant were not included in the original vaccine trials. So that's why there's no outright recommendation from the CDC when the Moderna and the Pfizer vaccines came out of what to do with pregnant women. I can tell you that anecdotally, I have a lot of physician friends that were pregnant at the time that vaccine distribution was happening for healthcare workers, and all of them took the vaccine, and all of them did very well. That being said, what I can say is that the current CDC recommendation, I reviewed it right before this session, is that if you are in a high risk profession, or you're in a high risk environment, and I would classify prisons as a high risk environment, then the recommendation is to take the vaccine. There are currently enrolling studies of pregnant people to evaluate the effectiveness and the safety of the vaccine. But we simply just don't have that data from the initial trials. But what I can say is, from the experience that my friends have had and that I have seen, no one has had any particular issues. And they have done studies in pregnant mice to evaluate, just to make sure that there are no issues with the fetus, and they didn't find any concerns. So I can't tell you one way or another what to do in that situation, because I do think it has to be a personal decision depending on your risk. But I can tell you that personally, if I had been pregnant at the time that I had received the vaccine, I would have taken it for sure, because I think the risk far outweigh the consequences. And we know that pregnant women that actually contract COVID are at higher risk of developing severe COVID. And that data recently came out over the last month. The second part of the question, as to whether someone who recently tested positive for COVID and is pregnant, should they take the vaccine? We do recommend that there is a period from the initial positive test to when they take the vaccine. There's no hard information about that. Usually we say about anywhere from a month to 3 months afterwards for you to take the vaccine. And that's because we know that your body is going to generate antibodies from that infection. And so you're going to be protected for a period of time. But after that initial 3-month period, we don't know what's going to happen to those antibodies, as I said in the first question. And so at that point, we would recommend that you get vaccinated.
But for, say, if someone who contracted COVID back in May, would it be safe for them to get the vaccine now?
Oh, yes, yes. In that case, yes, because it has been more than that 3-month mark, and so we actually would strongly recommend that they get vaccinated.
Thank you. Moving a little bit to some of the side effects of the vaccine, will folks feel sick after the vaccine, and what are some of the other side effects that come with that vaccine?
Great question. So I can tell you that for both the Pfizer and the Moderna, we'll focus on the Moderna because I believe that's what's available through the Virginia corrections. About 30% of participants experience what were considered moderate side effects. And moderate side effects, just so that everyone's aware, would included low-grade fevers, body aches, just feeling kind of crappy, like you had the flu, and tired. And that was about 30% of people. Most people actually did totally fine and maybe felt a little bit tired for about 24 to 48 hours. I can tell you my own personal experience. I had my first shot at the end of December, and in January, I had my second shot. After the first shot, and I got Moderna, after the first shot, I was pretty tired. I slept for about 12 to 13 hours that night, and then I woke up in the morning and I felt totally fine. The second shot, and traditionally, and from what we have, the information we have from the data from the clinical trials, we know that people had more side effects with the second shot. After the second shot, I had low-grade fevers to about 99 and 100 for about 24 hours. Felt like I had the flu and just tired and achy for about 24 hours. And then the next morning, I got it on a Friday. That was on Saturday. On Sunday, by the time I woke up, I felt totally fine. That is the experience of, I would say, the majority of the population. If not, the majority of the population actually doesn't even have the fevers and the body aches, and they just feel a little bit of tiredness. There are some reported cases that I would say are more on the extreme side of allergic reactions, which were pretty publicized in the news. But in looking at the number of allergic reactions that have happened throughout this country, even as millions of vaccines have been given to people, that percentage of allergic reactions is actually totally in line with what happens with other vaccines every year, with what happens with the flu shot, with what happens with tetanus. And so this is not causing an excess of allergic reactions. It just so happens that there are people that are going to have those reactions to vaccines. And that's why if you've had a severe reaction in the past, we recommend that you likely hold off on getting the vaccine.
And to those side effects, I've heard before through the grapevine that sometimes maybe taking Tylenol or ibuprofen can reduce your immunity because you're supposed to let the fever right out. So should folks take ibuprofen or fever reducers if they do get those aches and pains and side effects?
That's a great question, Marcy. It's a very very intuitive question because I think a lot of the lay public is not aware of that. But what we recommend and what was recommended to us in the healthcare profession was you don't take anything before, like prophylactically. Afterwards, for example, like I did, I was telling you I had low-grade fevers. I felt kind of crappy for a day. I took Tylenol, and what I would recommend is that people don't feel great, that they're perfectly fine to take Tylenol. If you can avoid it, I would hold off on ibuprofen just because it does suppress the inflammatory cascade in your body a little bit more. But ultimately, if you don't feel great and this is going to help you afterwards, I don't think it's terrible to take it. This is a theoretical risk. It's not something that's actually ever been proven in scientific studies. And so for my patients, and including for myself, I definitely took Tylenol afterwards. Before, I wouldn't take anything before.
All right, Doctor, we still have some questions coming in the chat about some specific conditions and things like that, and we'll sort of round back around to those. But we wanted to pivot a little bit and talk a little bit about development of these vaccines. And I know there's a few different ones out there. I think there's a Pfizer vaccine, a Moderna vaccine. I think Johnson & Johnson just came out with one, or just got approval for one. So what is sort of the approval process through the FDA or whoever it might go through, and what are some of their standards before these vaccines get rolled out to the general public and to people that are behind bars? Is there any difference? Would somebody behind bars be getting a different vaccine perhaps than somebody in the general public? Are these things, you know, being tested on prisoners? I guess is sort of some of the concerns that we've gotten as well.
So I first want to answer that question because I think it's really pivotal. And just to say that a person behind bars is going to get the same Moderna vaccine that I got. There's not going to be any difference between them. And to explain a little bit of the process of how we came to this point of having soon to be 3 available vaccines. The Johnson & Johnson vaccine is going to go up for FDA approval on Friday the 26th. So the first step is that after vaccines are developed, there are smaller clinical trials. Usually they're called phase 1 trials, and they usually happen with about 500 to 1,000 participants. And that first step is to evaluate safety. And that happened a while back now. And then they go to larger trials, phase 2 trials, that are more in the like 5,000 range, maybe a little bit lower. And the phase 3 trials, which are the trials that happen right before the vaccines were up for FDA approval, they were in the range of about 30,000 participants. So we're thinking about 15,000 participants in the placebo group, so the ones that didn't actually get the vaccine, and roughly about 15,000 participants in the vaccine group that actually got the vaccine. And these were what is called randomized controlled clinical trials. And so this is the gold standard for science, because you can accurately figure out if a vaccine is effective or not, because you have what's called a control group with a placebo group of people that aren't actually getting the vaccine. So those trials happen, or they finished roughly, I think about November is when the Moderna and the Pfizer trials finished. They acquired that information on how many people got COVID from the ones that got the placebo and how many people got COVID from the ones that had the actual vaccine. And they submitted for what is called emergency use authorization to the FDA, which is what these vaccines have. And this, to my basic knowledge, I'm not a public policy person, is a more of a way for these vaccines to get approved in emergency situations, which we are in one right now. That being said, that doesn't mean that anything was skipped in the scientific process. These vaccines went through all the appropriate trials, the phase 1, phase 2, phase 3 trials, and all of the data was scrutinized. I think it was probably more scrutinized by the FDA, because they knew that the eyes of the world were going to be on these vaccines. And afterwards, after emergency use authorization, that's when they can be rolled out to the general public. And in the general public, I'm also including those folks that are incarcerated. And everyone, again, just want to reemphasize, is getting the same vaccine. This is not being tested on prisoners. In fact, this was tested on a population that in the community, and those were the 30,000 participants, 15,000 which got the vaccine and 15,000 which got the placebo. And so those tests have been done. This at this point is to prevent serious COVID from happening.
It's really incredible, but that these vaccines have been developed so quickly. But how normally I think, don't these things take years? How can a safe vaccine be developed so quickly?
Another excellent question that I've heard a lot. And so here's what I would say. Normally, the process of developing a vaccine happens over the course of 5 to 10 years. And that's because there's usually a lab or a biotech company that focuses on this. And it's like a particular project that one lab in a biotech company has. This was a situation where literally every scientist in the world and every biotech company in the world and all of the resources of the entire world were focused on one situation. That has never been the case in human history before. Perhaps polio would be like the only real comparison, but that has never been the situation before. And it's sad to say, but it's really a resources game and a financial game. And so everything was just focused on this for a very finite period of time. And I can tell you personally, because at UCSF, everyone's research kind of stopped when COVID started. My research is in hepatitis and HIV, and all of my colleagues have different research interests. And now we're all doing COVID. Everyone's doing COVID. And so everyone's focus has just been really pointed in the direction of COVID. And more importantly, the financial resources to make this happen in a short period of time were readily available to this company. That has never been the case before. And that's how these vaccines came about so quickly, because there was money, there was manpower, and there was essentially the will and the drive to do it because it was such an emergent situation. But without having any real comparison in the past, I totally understand why people are skeptical, because we have been told for a long time, vaccines take time, But the regular vaccines, the flu vaccine, hepatitis vaccine, they don't have the same level of commitment that the COVID-19 vaccines have had.
So we've mentioned the Pfizer, Moderna, and the upcoming Johnson & Johnson one. I think there's even more forthcoming. What are the differences between those different vaccines?
So without getting too much into the nitty gritty, the broad differences are that the Pfizer vaccine and the Moderna vaccines are what are called mRNA vaccines. The other vaccines, including the Johnson & Johnson one, and then there's other vaccines that are more international, the AstraZeneca, there's a Sputnik vaccine based out of Russia. All of those are sort of in different phases of development. But let's just talk about the Pfizer and Moderna on one hand and the Johnson & Johnson on the other one. So the Pfizer and Moderna is an mRNA vaccine. The Johnson & Johnson one is a more traditional way of making vaccines that is called an adenovirus vector vaccine. So without getting too much into the science, I want people to think about this way. Your immune system has to essentially build antibodies against coronavirus. The way that the immune system works is that you have to recognize something as foreign, and then by recognizing it as something that is foreign, your immune system builds a response to it, and that response is called an antibody. And so the mRNA vaccines, or the Johnson & Johnson, or the Pfizer and the Moderna vaccines, the mRNA ones, they essentially package a small amount of dead coronavirus, of a protein on the spike, a spike protein on the outer part of the coronavirus. If you think about, the news has essentially the picture of the coronavirus has little spikes on it. A part of one of the spike proteins is encoded inside a lipid nanoparticle. This is just a vehicle for that that protein to get into the body, and for the immune system to recognize it as foreign, and thus subsequently making antibodies. The Johnson & Johnson vaccine is a different way, a different vehicle for that protein to get into the body, for the body to recognize it as foreign. Think of it as like the mRNA is like the sexy Tesla, that's like the new way to get to a store. And the adenovirus vaccine is like a reliable Toyota. They both get to the same place and they both accomplish the same place. It's just one is a more modern, sleek way to do it that actually makes it just faster to produce the vaccines. The other big difference, I should note, the other big difference between them is their efficacy. So when we talk about efficacy of vaccines, what I mean is the reliability of the vaccines to prevent mild COVID disease. So for the efficacy of the mRNA vaccines, they're both above 90%. The Pfizer one is 95, the Moderna one is 94%. For the Johnson & Johnson one, it's a little bit lower. In the United States, I believe it was 72%. But remember, that is to prevent mild disease. the name of the game here, and I think what the lay press unfortunately doesn't emphasize enough, and I think what the medical community is focused on is we want to prevent people from dying. We want to prevent people from getting seriously ill. What I want people to remember is that even though the Johnson & Johnson vaccine has an efficacy that may be lower than the Pfizer and the Moderna one, the Johnson & Johnson one prevents severe disease about 85% of the time. And the Pfizer and the Moderna one prevents severe disease almost 100% of the time. So if you have an option, then you can decide what you want to take. Maybe you want Moderna, maybe you want Pfizer. If you're gonna get Moderna, which most of the incarcerated folks in Virginia, sounds like that's what they will get, you're going to be protected from mild disease, and you're also going to be protected from severe disease. If your only option is Johnson & Johnson, that's also a great option because it's gonna prevent you from getting severe disease. It's gonna prevent you from going into the hospital and from essentially having more deleterious consequences.
So if someone gets the Moderna one first, and then do they need to get the Moderna one second, or can they switch from Moderna to Pfizer?
We are, the CDC, and I think the medical community does recommend that you keep the same first and second doses. In extreme circumstances, what they're saying is you can go from one to the other, but it has not been studied. We don't have any information about people getting one and then getting the other. So we recommend that people get the same ones.
So Doctor, at the beginning of sort of your development answer there, you talked about how part of this vaccine and its delivery is effectively injecting some dead vaccine into the patient, into the recipient. So I think there's going to be sort of some question of, if you're injecting me with vaccine or injecting me with with virus, if you're injecting me with dead virus cells, can those sort of whatever come back to life or give me COVID? Can I get COVID from getting one of these vaccines?
And the answer is no. I can unequivocally say no. So when you're getting what's called a dead virus vaccine, as opposed to a live virus vaccine, there are some live virus vaccines where there is a possibility that you get the virus during the whole process. Polio is an example of that. The COVID-19 vaccines, all the three ones that I've talked about, the Pfizer, the Moderna, and the Johnson & Johnson, they are all contain a protein of the spike in the coronavirus that is dead. So you are not going to contract COVID-19 from getting these vaccines. You may not feel great, as we talked about, for 24 to 48 hours afterwards, but that doesn't mean you have COVID. That means that your body is building antibodies and it's building immunity to COVID. And that's why you're having those symptoms. And that's a really big distinction, Sean.
Going off of what Sean said, you mentioned these things like lipid nanoparticles and mRNA. Will that, I've never really heard of those before, and I know this is a new vaccine technology, but what is that safe? Is the vaccine going to change your DNA or RNA? Is there any sort of like tracking chip in it? Is there mercury in it? I know some folks are worried about vaccines that might contain mercury, just because it's such a new technology.
Right. So there's obviously some parts of these vaccines that are proprietary that is not available to the general public, including myself. That being said, what I can tell you is, to my knowledge, there is no mercury, there is no tracking chip in the vaccines. I don't think that's even a technology that we have. The mRNA component of it is a new way to make vaccines. And that is the really novel part of this. That being said, mRNA technology has been used in cancer treatment for a very long time. And we have a lot of information from the cancer world about the use of mRNAs. And we know that it is safe. That being said, do I know sort of going forth in 5 to 10, 15 years with certainty? I have to be honest and say that I don't think the scientific community has that information. We know that they are safe from the trials that we had that were roughly about 30,000 people, as we've discussed, and that is the safety data that we have. That being said, the situation is so dire with COVID that I personally, and for my own family, I think that we all have to kind of weigh our risks and benefits, and a lot of us have chosen to take that risk because we know that they were safe in those initial trials.
We appreciate definitely your honesty, just because it's such an evolving situation. But is there any evidence that it could change your DNA or something so far?
No, there is not. There is no evidence that it can change your DNA. Essentially, that lipid nanoparticle dissolves after it goes into your body, and then the protein is simply essentially shown to your immune system so that it can build antibodies. But we do not have any evidence that it can change your DNA.
And sorry, I just had one more follow-up question. You mentioned that some of these vaccines are proprietary. Some parts of the vaccines are proprietary. How can people be sure that the secret parts don't contain, I don't know, mercury or some sort of advanced technological device or another hidden ingredient that we don't know about?
I mean, to be quite frank, I cannot guarantee you 100% that is not what is in those vaccines. Just to be very honest, what I can say is that if that were the case, if there were chips, if there was mercury in the vaccines, or if there was something that would have caused some reactions, I guarantee you that we would have seen it in the initial trials. And that's why I think we have to trust those trials and trust the safety data from there, because it was a lot of people, and in that large group of people, we would have expected to see something if there was some safety concern.
So for folks who may be in family detention centers, or can you hear me?
Yeah, there we go.
My mic goes out sometimes. So who may be incarcerated in family detention centers or juvenile centers, are children vaccinated? Are there any long-term effects? I know it's so early, it's hard to know long-term effects maybe, but are there any short-term or long-term effects? And kind of going back to the mercury, is there mercury, and does that cause autism down the line for kids who may receive vaccine?
So much like pregnant women, children were not included in the original trials. They generally are not included in the first trials of new vaccines. And so children at this point are not getting vaccinated. And I actually don't expect that they will get vaccinated probably until the fall, if not later. Currently, Moderna, I know at least, is recruiting teenagers between the ages of, like, I would say 11 to 16, I can't remember exactly, for trials in that age range, just to see the efficacy in that population, since we don't have any data about children. But children at this point are not getting vaccinated anywhere. And we know that children under the age of 10 are less likely to spread COVID and to get COVID. And so I imagine that population, it's going to be a while before vaccines are offered to them, just because they simply are not the ones that are spreading the disease and are not getting the sickest from it.
So Doc, obviously within correctional centers and Virginia in particular, the demographics there are sort of inverted from what you have in the general community. And I think there's some concern, I know from some people that I've spoken with, that these vaccines, whether it's Moderna or Pfizer in particular, are maybe not as effective. And I know you talked about the efficacy rates or for a little bit ago, but is there any sort of difference between whether it's different demographic groups? Is there a different efficacy rate for perhaps people of color or otherwise that you can speak to?
So I always go back to those initial studies, because that's where we get the majority of our information from. And both Pfizer and Moderna, and Johnson & Johnson as well, but the information that we have right now is from Moderna and Pfizer. Those initial studies of, again, roughly about 30,000 people, about 30% of that 30,000 were what they called underrepresented minorities. So that included people that were African American, people that were Latinx, people that identified as Pacific Islanders, and basically the communities that were hardest hit by COVID. And so 30% in a clinical trial, I know it doesn't sound amazing, but actually that's really, really good. For the most part, clinical trials are overwhelmingly white, they're overwhelmingly male. And these studies really tried to be diverse because they wanted to represent a broad spectrum of the population, including those folks that maybe were from different ethnic groups and are not generally represented in those clinical trials. And so when I quote that efficacy, I really mean that efficacy for everyone. There are certain exceptions, of course, and those that I would say are people that have depressed immune systems. So for example, people that are undergoing cancer treatments, people that are on chronic steroids, people that are on chronic immunosuppressive medications for things like rheumatoid arthritis or Crohn's or things like that. We don't know, but we can theorize that their efficacy may not be as great, and that's simply because their immune system is not as strong as the immune system of, let's say, average Mary and Joe. And that's a theory. We do not have that information,
though. Even if it's should people with even if it's less effective, should people with who are undergoing cancer treatment or have suppressed immune systems, is it safe for them to get the vaccine, and should they get the vaccine?
Yes, so definitely they should get the vaccine. Currently in San Francisco, that is the next group of people that we're prioritizing for vaccination. It goes back to the discussion of patients that have diabetes, that have high blood pressure, that have cardiovascular diseases, and for example, COPD or anything that affects the lungs. Those are people that we know are going to likely not do as well from COVID if they get sick. And so they should definitely be prioritized for vaccination, and we recommend that they get vaccinated. If you are actively undergoing cancer treatment, I would recommend that you have a discussion with your oncologist about the whatever chemotherapy your chemotherapy cycle, so that maybe it's spaced out from the vaccines. And that's just simply because chemotherapy is going to depress your immune system. And so maybe there is a waiting game in between when your chemotherapy session is and your vaccine, because we do want to optimize that vaccine response, but you should definitely get vaccinated because realistically, some protection is better than none. And those are the people that are not going to do well.
After you get vaccinated, should you continue to wear a mask?
Great question, Marcy. So after you get vaccinated, we're definitely advocating that everyone continue to wear a mask and continue to adhere by social distancing as much as possible within the constraints of being incarcerated. That is obviously very, very challenging, but we definitely recommend people continue to wear a mask. The reason for this is we do not know for sure yet if you can continue to spread COVID. So remember the efficacy of the vaccines, what that tells you is the percentage of people that were protected from mild COVID disease if they got the vaccine. We don't know for sure that it prevents you from getting COVID and spreading COVID. It may just be that you get an asymptomatic case, or you get a very mild case. We have some emerging data that's coming out that suggests that if you get vaccinated, you're actually not going to be able to spread COVID or get COVID, but we don't know that for sure. And so the safe recommendation for everyone at this point is if you get vaccinated, continue to wear your mask, continue to adhere by social distancing protocols until the majority of the population is vaccinated and we have what's called herd immunity. And at that point, we can start transitioning to some of our normal routines and normal life.
Elaborate a little bit on herd immunity and what that looks like? What are the numbers for that?
So roughly, we say that herd immunity is about 70% of the population needs to get vaccinated. That's a lot of people still, and that's a lot of people in each state. That's a lot of people within the prison system that need to get vaccinated, and in this country overall. And so, for a long way to go. The United States is a big place. If you think there are roughly 300 million people in this country, maybe 250 million adults. It's 70% of 250 million adults. And while vaccination uptake has increased dramatically since January, shall we say, it is still obviously not where we want it to be. And that's more of a supply problem than anything. And as we get an influx of more vaccines, then hopefully that will change.
So Doc, we obviously there's a broad ranging population within correctional facilities nationwide, obviously, and of course in Virginia. And there's a lot of people and and there was actually recently a settlement in Virginia of a non-English speaking individual that didn't have access to information in other languages. So is there any sort of guidance that you'd give to institutions or facilities that are relaying this information to people that are not, English speakers or able to read or write English? And where would they get this information? And also, is there sort of a model policy and sort of what would that entail?
So I think probably the easiest way for people to get information that is available in other languages is through the CDC COVID website. They do have information available, I know, at least in Spanish, maybe in Cantonese. I haven't looked extensively, to be honest. That is probably the most central place to get it. And now that we have, I would say, a stronger national response than we did with the prior administration, I do think a lot of our guidance is coming from there. That being said, a lot is just still being done by local universities, on a state-by-state basis. And so if you're not getting the information that you need from the CDC in these different languages, then to be honest, I would probably reach out to your local university medical center, because I can guarantee that they have this information already in place, because they've had to give it to the patients that have gotten admitted, which primarily have been patients from underrepresented minorities, including the Latinx community. And so first, I would say CDC, because that's available nationwide and something that people can easily look up. But then if you don't find what you need there, probably your local university medical center is kind of what is taking the helm of this, of the pandemic and of the response on the ground for these communities of color that are being detrimentally affected.
So we've got some really great questions in the chat. First one being, how strict is it that you stick to the schedule for the second dose? And what happens if you are for some reason delayed in getting that second dose?
So the CDC is now saying that you can extend that second dose up to 6 weeks, or 42 days. And that's because they have new data that's come out from those phase 3 clinical trials that we've spoken so much of over the past hour. After that 6-week time period, we just do not have any information to say whether you need to restart the vaccination cycle, or what's going to happen. Are you going to have similar immunity? We simply don't know. So I think if it's extended past the 6 weeks, then you need to talk to your local health department and see what they recommend, because it might be on a case-by-case basis.
So I'd kind of like to throw a question maybe back towards another, maybe Marcy or Luis perhaps could maybe address this. So this last special session that started in August, there was a bill that was passed that sort of redefined correctional facilities in Virginia, particularly local correctional facilities, ICE detention centers, and it allows the states to sort of go and perform inspections of these facilities. We know that at ICA Farmville, they had the largest COVID outbreak in the country, killing Canadian nationals, one named James Hill. And there's no real indication that immigrants detained by ICE in Virginia are included in the 1B group, which is the group that's currently getting vaccines in Virginia. So when are immigrants that are at Caroline Detention Facility and ICA Farmville going to get vaccinated? There's people there. There's somebody named Wilmer that already had COVID once, and he's supposed to be getting released by ICE because he's considered medically vulnerable under the Freyhat ruling. And ICE is sort of pointing to the state. So ICE is pointing at Virginia, and then Virginia and other states are sort of pointing back at ICE of whose responsibility it is to make sure the vaccines reach this vulnerable population. So what is Virginia doing to ensure that no more people within these ICE detention centers in Virginia are going to die or be infected with COVID? So I don't know if it would be Marcy or Louis who would be best at answering that question.
I'm happy to take that. It's a really good question. So, I mean, this is something that Legal Aid Justice Center and many community groups grapple with and fought over. Even before there was a single COVID case at either Caroline or Farmville detention centers. So, because they are ICE detention centers, but they're actually locally owned. In the case of Farmville, it's privately owned. In the case of Caroline, it's owned by the county government. So as of today, even before this bill goes into effect this spring, as of today, the handling of public health issues, which includes vaccine distribution, is actually through the local Virginia Department of Health district. So in the case of Caroline County, that falls under the Rappahannock district, and in the case of Farmville, that falls under the Piedmont Health District. In both cases, the local directors are expected to be in close communication with both the administration of the facility and ICE, and they are supposed to be the ones arranging for vaccine distribution in the facilities, just like they would in any other local or regional jail. This is just to emphasize, this is outside of Department of Corrections. They count as local or regional jails. As far as when they are going to get vaccinated, I and others at the center have been in close contact with these local districts, and we keep getting the answer that it's soon. But I encourage community members to keep that pressure up so that our fellow immigrants in Virginia who are detained in these centers don't get left behind. And then as far as what is Virginia going to do to ensure that no one more person dies, it really is on ICE, the administration, and the Virginia state government to ensure that no one person dies. They have a lot of similar mechanisms to what Governor Northam has in releasing people early. They mentioned the Freyhat ruling. This is a federal court ruling that mandates that ICE identify high-risk populations and proactively release them. A lot of community groups have been pushing really hard on that. Legal Aid Justice Center has ongoing litigation against Farmville and ICE that results from their serious mishandling of a COVID outbreak this summer that resulted in the death of James Hill and many people. Over 90% of the people detained there getting COVID. Still the largest outbreak in the ICE detention center so far. So yeah, a lot of issues. We have a lot of litigation going on. There's a lot of organizing, I would say, to the community, keep going. But yes, it does fall in the local districts, and they are in the equation just like any other local jail.
Thank you for that very comprehensive answer, Luis. We had a few more questions from the Facebook chat about the vaccine. Uh, Dr. Roque, I know you compared it to other types of vaccines. Do we know if this is something that you're going to have to get every year, or is this kind of a one and done, like or maybe not a one and done, but one you only have to get every few years, like a tetanus shot?
Great question, Jason. And the short answer is we don't know. We don't know yet. And that's simply because not enough time has really passed to know whether people that are vaccinated have long-term immunity. And we're only going to know that answer when more time passes. We know that the vaccine produces a strong antibody response. And we know that at least 3 months afterwards, you still have antibodies, but time has to elapse for us to know that information. And so we just simply don't know at this point.
So we know there are a lot of outbreaks within prisons and jails. Can you speak a little bit about, while people wait for the vaccine, what can they do to protect themselves while being incarcerated as we wait for that supply to catch up with the demand?
So there's obviously a lot of constraints while you're in prison or in jail that prevent you from doing things like social distancing. And so that aside, I think probably the strongest tool for people that are incarcerated to use is masking. And so we know that 1 mask is great, 2 masks is even better. And that is information that really came out over the last month. I'm not familiar with the regulations of prisoner masking, but what I would say is that if you can double mask, that's going to provide you with great protection from droplets. If you're able to cover your eyes, there is emerging data that is coming out that actually people that wear glasses for at least 8 hours a day probably have protection from greater protection from COVID. And that's simply because, and I wear contacts, but I wear glasses sometimes. And I know that when I wear my glasses, I'm less likely to rub my eyes and to spread droplets that into your eyes. And so it really depends on what's available to people that are incarcerated, but I think those are the 2 biggest tools that you have, and then regular hygiene, washing your hands as often as you can.
So Doc, I speak to guys that are incarcerated every day and exchange emails with them, and some of them are getting COVID now. When I had it, when I was incarcerated, was in April, right, sort of early on in things. And then seemingly these outbreaks at these facilities settled down for a little while, and everything in Virginia, they have what they call these red, yellow, and green zones. But after they settled down for a little bit, sort of inevitably, the people that didn't get, were not infected with the virus, an officer comes in who's positive, or a staff member comes in and infects somebody, and then they have another outbreak. And so that's happening sort of cyclically right now at pretty much every facility in Virginia that I'm aware of. And so, but seemingly at the same time, people they're doing these, they're doing the vaccines and giving out the Moderna vaccine. So is there sort of some sort of time period if somebody has tested positive, or if they currently have COVID and are being offered the vaccine, or they've recently recovered, is there a period of time they should wait before getting the vaccine? Should they sort of refuse or go ahead and get it? What's sort of the way to go about that, or how should that be handled?
So I think I briefly mentioned this earlier, but I think if you have had COVID, we know that your antibody response is going to last probably about 3 months, maybe a little bit longer. That being said, if you're offered the COVID vaccine within that time period, I think a good rule of thumb is if you have had like a mild case and you haven't needed to get hospitalized, as soon as you feel better, and you're back to your baseline, you can likely get vaccinated. If you've had a more severe case of COVID, you've needed hospitalization, and you've needed some of these more advanced treatments like these monoclonal antibodies, the recommendation is to wait at least 30 days from the CDC, and that's sort of changing on a maybe weekly to monthly basis, and so that may not be the case next month. So it depends on how severe your case is. I think for the standard person that probably felt crummy for maybe a week, but was able to stave it off and not get hospitalized, I think once you feel back to your baseline, it's likely okay for you to get the vaccine. That being said, to preempt another question that may come up, if you've had COVID and you do get vaccinated, there's a good chance that you may have some of these moderate symptoms that we discussed, and that's simply because you likely still have antibodies. So remember what antibodies do. Antibodies protect you from something foreign. And if you already have antibodies in your body and you're getting a vaccine, which again is something foreign into your body, that's that spike protein that we've talked about, your body, those antibodies, once it recognizes the spike protein, is going to essentially try to destroy it and build a greater antibody response. And so you are going to feel more of that inflammatory response. And when I say by inflammatory response, I mean those fevers, those chills, that malaise. So you're going to feel crummy for, I would say, maybe longer than 48 hours. I don't think that's a reason not to get the vaccine. It's just something that if you expect it and you kind of prepare as best as you can for it, then it will be okay. But it's simply because your body has already seen this. You've already had natural immunity, and so when you get the vaccine, it's just it's an increased response.
So I have a couple friends who, of course had it, and like I said, I had it, and I'm a little bit worried when I go to get mine, because I'm in with the next group. I'm in the 1C group in Virginia. A little concerned about what the response would be. And some of the guys that I know that did have COVID while they were incarcerated and have now received their first and second dose of the Moderna vaccines, there was some concern because some of those guys were getting hit pretty hard after the vaccine. And so there's other guys that had concerns that hadn't gotten their vaccines yet. They were concerned about how these people that had COVID got the vaccines and then were worse off even so than perhaps they were when they did have COVID. So is that likely sort of what the problem is, sort of what you just mentioned about your body already having these antibodies and I guess effectively launching an immune response to that? Is that's sort of what's happening?
That's exactly right, Sean. And I think that the key to remember is that period is transitory. It's a short period. And it's likely that shot is going to give you protection for a long time. We don't know whether it's going to be lifelong right now, but I hate to put it this way, but like 2 days of feeling crummy or 3 days of feeling crummy are likely worth protection for months, if not years, if not for the rest of your life. And so I think the thing to note is that if you were kind of expecting it, it doesn't catch you by surprise. And a lot of the folks that you're talking about probably were not expecting it. And that's the challenging situation, because it probably caught them by surprise. And so I think if people are more cognizant about it, that they may experience more severe side effects or just feel crummy for a longer period of time, then it becomes just something that you kind of have to get through. And it's not great. I mean, it's not pleasant. I wish people didn't have these side effects, but I think the thing to remember is that this is your immune system in action. And this means that your immune system is working and that it's going to protect you from further infection.
You may have spoke to this already, so I apologize if I'm making you repeat yourself, but how effective is the vaccine against the variants that we hear about?
So we have information from Moderna and Pfizer, and we have some information from Johnson & Johnson. And so I apologize that the variants have different numbers and names associated to it. I don't want to use stigmatizing language. I'm going to use it in this situation just for ease of people recognizing the variants. But we generally don't like to call it like the South African variant or the UK variant. But I think people are able to recognize that more. So we know that both the Pfizer and the Moderna vaccine do have protective effects versus the UK variant and the South African variant. And the way that they evaluated that is that they essentially took blood from people that were vaccinated and produced antibodies, and they tested it against the variants in the lab. And so they saw that the blood of patients that were vaccinated essentially produced neutralizing antibodies, or antibodies that are going to kill these variants when they were exposed to the UK variant and the South African variant. The Moderna vaccine did not have as great of an effect to the South Africa variant as it did to the UK variant, but it still produced enough antibodies where scientists do believe that it's going to protect you against the South African variant. The Johnson & Johnson vaccine, we have efficacy data. It was actually tested in both Latin America and South Africa, so we have a bit better information about that. And we know it did not perform as well in South Africa as it did in the US and Latin America. So it probably is not producing as high of antibodies to the South African variant, but we do believe that it's still likely going to be enough for you to prevent you from getting severe disease that's going to land you in the hospital.
So, Doc, I want to quickly circle back to something that you already you sort of answered, some of it, and I just wanted to sort of expand on the question a little bit, particularly with people that have these chronic conditions that are in prison. I teach CPR for a living. That's what I do now, and one of the things that we talk about is how cardiovascular disease kills more people than all forms of cancer combined every year. And there's a lot of people that are behind bars in Virginia and nationwide, of course, that suffer from these various cardiovascular diseases, for whether it's from lifestyle, and I can speak to the fact that the food that we're getting in prison is pretty terrible, certainly not very healthy, and it's hard to develop good eating habits and have proper nutrition. So what about some of these cardiovascular diseases, or someone with a leaky heart valve, some of these different types of chronic conditions? Is it safe for these individuals to get the vaccine, or is it something that they should perhaps shy away from?
Quite the opposite. These are the people that should be getting the vaccine, because we know that they're the ones that, again, are likely to not do well if they get sick. I apologize. I don't remember the exact percentages, but I think roughly it was also about 30% of the people in those phase 3 trials that I keep going back on had comorbidities. So that just means that about 30% of people had these things that we've been talking about: high blood pressure, high cholesterol, heart disease, diabetes. And so they really tried to include those people in the initial vaccine trials because they wanted to study the efficacy of the vaccines in those patients. And so it's quite the opposite. These are exactly the people that should get vaccinated.
I just had one more question from we received a question by phone from a woman who has 2 relatives who are incarcerated, and this is a question that I have too. I guess what is in a vaccine? Like, I know there's like the mRNA, there's the dead virus, there's some delivery vehicle. I read something about called an adjutant or adjutant.
Adjuvant.
Adjuvant.
That's the
Yeah.
adenovirus. So again, there are some like particulars about like the specific things that are in the vaccine that I don't know about, but the main things that that vaccines always have are a part of the virus that you want to be protected against, so the spike protein. They have a vehicle for it to get into your body, so that's the adjuvant, which adjuvant refers more to the traditional way of making vaccines, so really the adenovirus vaccines like the Johnson & Johnson, whereas the mRNA, again, is this kind of new fancy way of making vaccines. There are certain other components in vaccines that they're like peptides, glycopeptides, that are just that are there to like make the chemical reactions happen, for the vaccines to be stable and safe to get into your body. And those specifics I are not privy to me, and I apologize that I don't know all of the details. But the main components that that are important to know are the part of the virus that you're going to be building antibodies against, and then the vehicle to get it in there. And there are things that, as we've discussed, are proprietary and that Pfizer and Moderna are not going to release to the general public.
Another question from the chat. So can pneumonia be detected after someone has had COVID, but then has since tested negative? Someone was released, but then hospitalized 2 days after with pneumonia.
So say that one more time.
So they've had COVID, they tested positive, then recovered, had negative tests, and then were released from incarceration, and then were hospitalized with pneumonia. Was that pneumonia, could that possibly be from the COVID diagnosis before?
I think it depends on the time period. So we know that COVID symptoms tend to be more severe roughly about 5 to 7 days after initial symptoms start. So let's say that on the first of the month is when you develop your first symptoms. 5 to 7 days later is when we expect that those more severe symptoms are going to pop up, that shortness of breath, that low oxygen levels. At around the 10-day mark is when we start, 10 to 14-day mark is when we start to really think that you're not infectious anymore. And I don't know the specifics of this situation, but if we're talking about like months have gone by between the initial diagnosis and when this person was diagnosed with pneumonia, then I don't think it's related to that COVID diagnosis. If their initial COVID symptoms got better and then they felt totally back to normal. Pneumonia is can be due to a host of different things. Bacteria, can be due to viruses. And pneumonia is really just a clinical diagnosis. It doesn't necessarily tell you what it's from.
So Doc, I'm going to try and give you another quick little break. And I'm going to throw a question to Jason, Marcy, and perhaps Luis might be good at answering this. So there's a facility that some people have received their first dose of the vaccine. However, it's been more than 40 days since they received that dose, and they haven't received their second yet. Do we know of anything that's sort of being done to address that for people that aren't receiving perhaps their second dose? And maybe that might also pivot to you, Doc, on the back end of the question of what sort of the impact if you don't get that second dose. But if Luis or Marcy or Jason can maybe address the first part of the question of what can be done to sort of get that second dose to these people that haven't received it.
Sure. Yeah, I can talk a little bit about the work that we've been doing. So for a little bit of background, the ACLU and Virginia Department of Corrections entered into a settlement in a case called Worley back in April, which kind of set basic hygiene and sanitation standards and established the early release program. And we've also been using it to get information about the vaccination practices, how many people are being vaccinated, where they're being vaccinated. And this is an issue that we would like to be, we would definitely be interested in learning more about, because what we can do is we have these weekly information exchanges with the Virginia Department of Corrections Council. And this would be something that we would want to investigate and see why it's happening, and see, and if that's the case, just to figure out what their plans are for getting them their shots. Because I mean, I can't speak to the medical effects of it, but I mean, I know we would ideally want them to get them on time. So this is something that we would want to bring up with VDOC and in our weekly exchanges. And if there's any more information, I would encourage you to submit it to the Facebook chat or the Google form, and we can be in touch about it.
And Doc, what would be the sort of back end of that question? If somebody hasn't gotten the thing, do they need to go back to get the first dose again, or sort of what would be the logistics of that?
So we really don't know, unfortunately, Sean. So after the 42-day mark, we just do not have any information. We know that the first shot is going to give you a pretty good level of protective immunity, usually around the 80% mark. It's really that second shot for the Moderna and the Pfizer that takes it up a notch into the 90th percent. So it's not like you're kind of dead in the water situation where you're not protected at all if you don't get that second shot within that 42-day window. It just may be, I would theorize that if that window gets extended past 42 days, that you probably are not going to get to that mid 90% efficacy. You may be a little bit lower, but I would still recommend that people get that second shot. I don't think it would be the situation where they would just restart the vaccination series because, again, our supply chain is so low right now. I think they probably would give them the second shot. It would just be delayed. And just to reiterate, we don't have any information about what would happen.
I think we've covered all of the questions in the chat that have come in through the chat. Unless I'm wrong, Sean or Marcy, did we miss anything?
I think we're pretty good. There's a few other more sort of very specific things that would probably be better addressed. Sort of if somebody has some more specific questions, maybe it's not obviously not for the doctor, but I saw one about using comments, incentivizing getting shots and things like that are probably better addressed maybe in the chat or in another town hall. So I think we're pretty good. I think we got everything for the doctor.
Great. Thank you so much for sharing this time with us, Dr. Roque. It's really a privilege to host you, speak for, and just really to be able to share this information with us, to share this information with the families of incarcerated people who are hopefully watching, and hopefully we'll have that information passed on to them from a source that they can trust. And it's really meaningful that you were able to join us today. And I just to wrap up, I'm just going to pass it off to Luis just to reemphasize the kind of broader goals of the COVID-19 Justice Coalition. But please join me in thanking Dr. Gardner for giving us her time today.
It's my pleasure to be here. And again, I'm happy to join at some other point if more questions come up or people want to hear more information.
Yes, thank you, Doctor, and thank you to the COVID-19 Justice Coalition and ACLU Virginia and the Humanization Project. So for the COVID-19 Justice Coalition, as Sean opened with, we are working to release as many people as possible, as safely and quickly as possible, have transparency for releases, as well as conditions and safety behind bars during this pandemic. And for that latter point, that is a huge reason why we have this, as Dr. As Dr. Taj Mahanaft broke down for us, there's a huge lack of good information behind bars, much worse than there is in the general public. So this is why we have to hold these sorts of things. Thank you to everybody who listened in. Thank you so much to everybody who submitted questions. I encourage everybody to share this video and get involved with the COVID-19 Justice Coalition. And I just want to reiterate that, Governor Northam still hasn't joined us for a town hall, and didn't join us for this one. But we will continue to, have him on so that he can hear directly from the community about the impacts of COVID-19 behind bars.
All right, thank you, everyone. Thank you to my co-host. Thank you to Dr. Roque, and it's really been a pleasure. And I hope this was helpful to the audience.